Meditech orientation for nursing. The patient's plan of care. Previously, we reviewed creating the status board. The status board allows you and other clinical staff to quickly assess which patient requires attention. The status board also provides a single starting point to all the screens and functions to view, edit, and document patient information. Documentation is entered from the patient's electronic plan of care for each of your patients and is accessed by utilizing the Quick Launch feature of the status board. Since our documentation utilizes the nursing process, let's first review that. The nursing process is a systematic, rational method of planning and providing care which requires critical thinking skills to identify and treat actual or potential health problems and to promote wellness. It also provides a framework for the nurses to be responsible and accountable. The nursing process consists of sequential and interrelated steps or phases. Each patient admitted to Alliance Community Hospital will have one plan of care. The plan of care includes problems, outcomes, and interventions. This is named the Hospitalized Patient Plan of Care. The plan of care for the patient will be automatically loaded onto the patient upon entering the chart at admission. Within the Hospitalized Patient Plan of Care, 7 problems will be defined. These 7 problems have been determined to be inherent due to hospitalization. The 7 problems are discharge planning, knowledge deficit, safety, activity intolerance, safe medication use, alteration in nutrition, and potential for spiritual needs. This is a visual aid to help you understand the plan of care. The plan of care enhances critical thinking by grouping the care that is needed for your patient. For example, notice in the yellow section, the outcome and interventions all relate to the safety of the patient. Also predefined on your patient is a standard care set. Included within the standard care set are the initial care items, intake and output, daily hygiene, and physician notification. Intervention sets, as well as any additional problems, may be added to the patient based on reason for visit, current diagnosis, and physical assessments. Intervention sets are added to the patient by the care provider based on level of care as ordered by the physician. The standard care set, along with the intervention sets, are considered to be task-oriented and appear just below the plan of care. The patient's plan of care is interdisciplinary and will be utilized by nursing as well as ancillary departments, including respiratory therapy, physical therapy, nutrition, pharmacy, and pastoral services. All ancillary service interventions can be easily recognized by the prefix that displays on the name in the description column. Checkboxes are available for selecting single or multiple interventions and outcomes to be documented. Type and description columns indicate whether that item is a problem, outcome, or intervention, and its title. The status tells the user if the item is currently active, complete, or active S. Active S status indicates interventions that have been suppressed because they exist somewhere else on the plan of care and only need to be documented one time. Documentation for these assessments should be completed on those that are active and not suppressed. The question mark column allows you to view and edit item details of the patient's plan of care. When using these screens to view the details for plans of care and their components, the problems, outcomes, and interventions, you can click another component from the detail page to display. Each subsequent page of the viewer displays the details for the component highlighted on the detail page. The detail viewer also allows for individualization of the patient's plan of care and will be reviewed later. The frequency column defines the minimum amount of documentation that is needed for individual outcomes and interventions. Keep in mind this is only a minimum requirement, and documentation can be entered at any time that the care provider sees necessary. Any items shown with a frequency of every shift must be documented at least once during your scheduled time with that patient. The last done column provides information as to when an item was last documented and provides a reference point as to when it must be documented again. The target column is currently not used. Customizing the patient's plan of care. The buttons above the plan of care table allow you to restrict the view to the different components of a plan of care. The overview page displays all components, including the problems, outcomes, and interventions. Add and insert under buttons under the plan of care table are for adding problems, intervention sets, and individual interventions. Select the Add button to bring in additional problems as they are identified through admitting diagnosis, physical assessment, and history questions. From the Header tab, select Problems and any word. In the search field, type in a keyword of the problem you would like to add. For example, Post will search for all problems with the word post in the title, mnemonic, or a keyword. Keep your search broad by only adding a word fragment or one word. Select the problem or problems you would like to choose and click Save. There are currently approximately 40 problems available for choosing and were selected from Alliance Community Hospital's most frequently admitted diagnoses. After identifying the problem you would like to choose, select Save and add it to the patient's plan of care. Click on the information icon for more details about it. Clicking on this icon allows you to view the outcome as well as the interventions included to achieve the patient's goal. Adding an intervention set allows you to quickly apply interventions that have been grouped together. In the search field, type in a keyword of the intervention set you would like to add. For example, Enter will search for all interventions sets with the word Enter in the title, mnemonic, or a keyword. Keep your search broad by only adding a word fragment or one word. Select the intervention set you would like to choose. Notice the information icon is available for viewing details about the intervention set, similar to that of the problems. Select Save to add the intervention set to the patient's plan of care. Intervention sets are added by selecting the Insert Under footer tab. Insert Under is utilized so that the intervention that is being added will display under the appropriate problem and outcome. Select Insert Under to bring in individual interventions as needed. The outcome which you would like the intervention to be inserted under must be highlighted for the Insert Under button to be available for selection. From the Header tabs, select Interventions and any word. In the search field, type in a keyword of the intervention you would like to add. Keep your search broad by only adding one word. Select the intervention that you would like to choose and select the Add button. After choosing the intervention you would like to add, select the Save button. The intervention will be added under the problem and outcome that was selected. As previously discussed, the question mark column allows you to view and edit item details of the patient's plan of care. The item detail page can also be accessed by highlighting the intervention, outcome, or plan to be viewed or edited and clicking the Detail button from the footer. The text field of the item detail page should be utilized to individualize the patient's plan of care. This field is edited by selecting the Edit tab and free texting the information you would like to enter. Select the Back button when you have completed your entry to return to the Plan of Care page. If no item detail was previously entered, the question mark column will not have an I icon. Once information is entered, the I will display. Problems, outcomes, and interventions can be added by other disciplines to customize the patient's plan of care. The patient's plan of care is interdisciplinary and will be utilized by nursing as well as ancillary departments.